So when we're talking about IT band syndrome, a lot of times what happens is we notice there's some lateral abdominal weakness or oblique weakness, as well as some lateral glute or glute medius weakness. We see this as a breakdown in form with some pelvic movement or torso movement. And what we want to do to address this, or a really great exercise to address this, would be a side plank hip abduction. So we get into a side plank with our feet stacked, hips up in the air, and we lift that leg up and down. What we want to make sure of when we're doing this exercise is that our foot that's raising is in line or behind us, and we're leading the movement with our heel or our toes pointing straight forward. A really common compensation with this movement is that foot comes forward or your leg comes forward and your toes go up to the sky. What that's doing is transferring load from our glutes to our hip flexors and our TFL. So what we really want to do is strengthen our glutes, that way we can offload the IT band. So again, we bring the hips up, foot behind, lead with the heel or toes pointing forward, and you'll notice the difference going from behind the hip to the front of the hip if you come forward with your toes up versus if you go behind you with your toes pointing forward.